I'm hearing this need for the caregivers to actually get care themselves.
Absolutely.
And that seems to be sort of a common phenomenon. That's what I'm hearing.
Yes.
And it's overwhelming because they have so much. They live with other people. They have tremendous responsibilities as well of not only the patient or their loved one, but also family members and kids and or grandkids or animals or pets.
Yes. Yes.
And then one of the things that I think that's really knowing who you are, I'm not surprised, and I'm really happy to hear that you saw that there was a need and you found a space to then provide that need to these families that are in desperate need for support. And can you share with me about the existing, how did you discover this need? I know you talked about accessing other support group, but what was it that didn't sit right with you or missing?
Well, Barry in 1 year had 5 hospitalizations, and I knew for myself that I was suffering PTSD. I mean, he could sneeze, and I would be startled out of my sleep thinking there's some event that's occurring and I'm going to have to call 911. So I knew that I myself was suffering. And I saw that it was very difficult for me to negotiate simple things like appointments. Like if I had a medical appointment, I often would have to change it in order to prioritize Barry's needs. So I recognized that it was going to have a deleterious effect on me, that the stress of it, the PTSD symptoms were beginning to appear. And I reached out, as I said, for professional support from 2 therapists. And I reached out to our clinic, to their support group, and things were not working out. So I've always been a self-starter.
Yes.
And I've been a professional service provider. So I knew that the only way to really deal with this was to start my own group. I follow what I learned during the AIDS epidemic, that the people who are actually in the trenches doing the caregiving, involved with the machinery and the clinical aspects that are so challenging, that we ourselves know more than anyone else what it's like.
Yes.
Those friends that have stood by, and some relatives, it's been very difficult. People do not want to hear this. There are people who have phobias about blood. People have phobias about needles. People in our culture have aversion to bodily fluids.
Yes.
Anyone who's taken care of a child and helped with child raising knows you can't have aversion to bodily fluids.
Right.
Because with infants, you're dealing with feces and vomit all the time. It's part of raising an infant. Our culture needs to change the way it looks at health. There are certain moral issues that have to change. Our separation from our own bodies, our lack of knowledge of our own bodily functions. So there are very large issues that face all people who are alive, because all of us are going to suffer some kind of health issue, or someone in our life is going to suffer some health issue. And how are we going to prepare for it? I'm amazed at the women who are in my group, because they're all experts and they're all so tenacious. And most of them, well, I would say all of them, don't disregard their feelings. They're very in touch with them. And some of them have shared, I've had a total meltdown and I feel terrible about it, but I couldn't avoid it.
Yes.
Because the stress was just too much for me.
Wow.
So Maggie says about her husband being depressed, she says, don't get me wrong, I love him dearly. I just feel like I'm the one responsible, not him.
Yeah, I've read that usually sometimes the amount of burden the caregiver gives, sometimes people forget that caregiver needs care themselves.
Right.
And Stephen, let me ask you, those who are in your support group, are they can they afford help, or the health insurance can't provide them the type of help that they need? Or I know that there's some, in New York State at least, there are some programs where if you help someone, an elderly person, the family member can get paid for that.
That's a needs assessment. So what you're talking about is support that can come to a caregiver through Medicaid programs. And Medicaid, of course, varies from state to state. what is available. So there may be 50 different states. Well, there are 50 different states with 50 different rules on what Medicaid will
cover.
Reimburse.
Okay.
And Barry and I do not qualify for Medicaid. We get Medicare.
Right.
The other thing I didn't mention is that the group membership is global. I have members who are in Scotland. I have members who are in Australia. I have members who are all across this country. Some of them are in cities like Barry and myself are in Las Vegas, but some are in very rural communities. So the access to medical care and the travel to medical and clinic appointments is substantial in rural communities. The other thing in a rural community, well, it could happen in a city too. New York just suffered an earthquake, is during the treatment, dialysis treatment, you're using electricity. What do you do when there's a power failure?
Yes.
We did have an instantaneous power failure. It only lasted a few seconds, but I had to stop the treatment. There was no way that to resume the treatment. So that's a whole procedure where you return the blood, as I mentioned.
Yes.
Rinse back. But the group members are all over the world in life support.
Wow, that is absolutely fantastic.
So in terms of reimbursement, I don't know what Medicaid rates are for reimbursement for caregivers. I don't know who in my support group is receiving any reimbursement for care. But insurance does not cover it, and Medicare does not cover it. The other issue is whether there are even service providers that you'd hire to come to your home.
Yeah.
We do have a home health aide that we have hired for 3 days a week for 4 hours to help out with some of the housekeeping, some of the personal care for Barry. When Barry is well, he's been well for most of the year, he's able to drive and do all his appointments. But when he's had instances of hospitalizations and has had to go to a rehab, I've had to private hire some additional help. In terms of respite, the only respite that's available is for Barry to go to the clinic, and there aren't always slots open for him to get treatment in the clinic. So when I applied for respite recently, they told me there was a slot available at 3 a.m.
Oh my gosh. Are you serious?
I'm serious. In order for him to go to a slot in 3 a.m. means that I would have to get up at 2 a.m. to drive him to that slot and then pick him up after his treatment a couple of hours later. So I didn't really see that as respite for me. I saw it as a further stressor.
Yes, absolutely. Yes.
So I declined that help.
Oh my gosh. Wow. Yeah.
So this is a very complicated, life-changing process. And it's very different. And I don't minimize what other care partners have to do. I'm in awe of people that have to take care of anyone who has Alzheimer's or dementia. But this one comes with clinical issues and clinical training that is quite different. And it requires you to be certified in order to do it and to be approved to do it, which is, I think, different than the tasks that a lot of caregivers have for other life-threatening illnesses.
Yes, it almost sounds as though you have to be sort of, it's like what a nurse will do, or a nurse practitioner, like you said, or even a physician. I mean, the degree of training and the requirements that this procedure involves. So what was that like for you to go through that training?
Well, I was very naive. When we selected the method that we were going to choose for dialysis, we did some research and we did meet with someone who was an educator, but nothing prepared me for how it would change my life. I always wondered how house cats can live in an environment where they never go outside. And now I know.
Oh my gosh.
Because I'm living the life of a house cat.
Wow. Wow. So Stephen, what do you do to decompress? Well,
my support group has been enormously helpful. And one of the things that I felt was really critical in terms of a caregiver is that I shouldn't lose my identity. My identity isn't only as a caregiver. I'm a creative person. I'm a social activist, and I needed to continue that. So on weekends, when I have the day off, the 2 days off, I return to the work that sustains me, and that's creative work. The other thing I believe in very strongly, we're in one room, a treatment room, for several hours. I have found a way to make that treatment room work for me creatively.
Oh, really?
I am photographing thousands of images over the past year. In that room, I have found a way to see that room creatively and make it work for me.
Wow.
So I've always worked in digital photography, and now I'm working in Polaroid photography. I have 3 Polaroid cameras.
Okay.
And while Barry's in dialysis, I'm photographing objects. I'm photographing the scene that unfolds in front of my eyes with Barry hooked up to machinery. I think that's what is life-sustaining to me, is to continue in my creativity and not to give it up, and to continue learning. I'm studying all the major photographers. I have shelves of books now that I've ordered during the past year, and I continue to study.
Wow.
So my work is more about interiority than it is about people. I don't see a lot of people. Mostly I see Barry and 2 cats. But I have an interior life, and it's a very strong interior life. That's what sustains me. My brother has been in touch with me, maybe once a month or so, and has tried to be very supportive. A lot of it is about educating other people to what this is like.
Okay.
And some people can tolerate listening to it, some people can't.
Right.
In terms of friends, most of the friends that we have are in New York. That's our home city.
Okay.
In Las Vegas, we don't have a lot of support. We have a couple of people that we do see for dinner maybe once a month. But I would have to say that most people don't have a lot of toleration for this. I think they're afraid of it. We know people that have diabetes that are struggling to manage
themselves.
Their diabetes. Yeah. And they fear that this would happen to them. That they would have kidney failure. So I appreciate that it's very tough to hear about it. And some of it's very clinical.
Yes,
it's hard to describe what this has brought into our life without discussing it clinically. Because that's what we do every day. We do a clinical process.
Yes, absolutely. And it's very involved. Yeah.
Yes. The training for me wasn't that difficult, but I was saying earlier that I was very naive about it. I had no idea how complex it was. And I hold my breath every day. I'm proficient at doing it, but I always feel the stress of it.
Yes.
So when we begin the treatment and I'm starting the machinery, I hold my breath.
Yes.
I never know what's going to happen.
Wow.
And sometimes there's faulty equipment. You think that there's something clinically happening to Barry, and it could be that a cartridge or a connector is faulty.
Wow.
So you have to identify. The technical support for the machinery is quite good.
Okay.
So I have no criticism of the support that we get. And then the staff at the clinic has been great. I usually receive a call back, or if I don't connect immediately, I get a call back very quickly. The nephrologist that we have is fantastic. I'm very thankful for him.
Okay.
So I don't have any criticisms of that. My criticisms are much more systemic and macro than they are the micro management of Barry's care. It's the societal issues and why we're suffering an epidemic of diabetes with very little knowledge imparted into communities as to what they can do. And the access to care and the education to care, the mistrust of medical systems by people of color, it really needs to be overcome.
Yes. We experienced this in the pandemic all over again. Yes.
Yes. And it happened during COVID.
Yes.
I mean, it became highly politicized, but over 1 million people died. That's a huge amount of people in a very short period of time.
Yes.
It's really shocking.
Mm-hmm.
And I guess one of the coping mechanisms is amnesia, that this happened in this country.
Mm-hmm. So can you talk a little bit more about this not having this support group, being sort of isolated, having to deal with this on your own? Friends don't really understand. They send an emoji. I mean, is this sort of, and now hearing from your support group, is this with respect to LGBT elder care, how does that sort of fall into that? Do you think that they're more isolated and people really don't understand the different types of care and the needs that the healthcare needs and other needs that they may have?
Well, I think that there are certain aspects in the LGBT community that have to be addressed, and that has to do with the substance use, the fetishization of certain kinds of body types that I think are very detrimental to well-being.
Mm-hmm.
I mean, the whole bear community, I mean, I look like a victim next to most bears.
Right.
I mean, 3 and 4 and up 100-pound people.
Mm-hmm.
And it's part of a whole fetish in the community. And I think it's very sad. I mean, I think the normalization of obesity is something that really needs to be looked at. It's a very unpopular thing to say this. Mm-hmm. I don't want people to be shamed for their body type, but I think it's the incidence of diabetes in people who are obese is very high.
Yes.
And I think the education needs to go out into the LGBT community.
Mm-hmm.
In terms of services for the LGBT community, Nevada, where we live, is a rather progressive state in terms of LGBT issues.
Uh-huh.
However, when I reached out to home care agencies, I found there were barriers to care. Mm. We had the owner of one home health agency come to assess us for care, and I asked him about issues around LGBTQ, and he said that the providers would self-select out if they were unwilling to provide the care.
Wow.
That's illegal in our state.
Wow.
And I never heard from the president or the owner of this healthcare agency again.
Wow,
clearly
shocking.
He didn't want to provide the care.
Yes.
Other agencies I've called didn't even know what LGBT meant.
Wow.
So we did find one agency with a wonderful woman that's been providing care to us. And it turned out, she said, "Can I tell you something privately, something very personal?" It was about 2 or 3 weeks into her providing care to Barry. Mm-hmm. And I said, "Of course you can tell me something personal." She says, "I've received a kidney transplant myself. I was born with congenital kidney disease and got a transplant. So we were just so fortunate to have someone who understands kidney disease, yes, providing the care. But that was just the luck of the draw." Mm. I think in the LGBT community, we have to look at the model during the AIDS epidemic, mm-hmm, for community-based advocacy for the care that's required. That really was the model. I think all illnesses have to be politicized or understood politically. Mm-hmm. And, healthcare is the number one growth industry in this country.
Yes.
Based on the latest data from the Department of Labor, it's number one.
Wow.
So LGBTQ people have to make the healthcare systems work for us. Mm-hmm. We have special needs. Our relationships are different in terms of our spousal relationships, but also our kinship relationships, how we interrelate in terms of our community and what those kinship relationships mean. They're very deep. And in terms of my own experience, even though I feel abandoned somewhat during our crisis, my life has all been about chosen families and kinships.
Yes.
It hasn't been about my biologic family. It has been about the people I've met along the way of understanding who I was in terms of my identity.
Yes, and I had an interview with an attorney last week, and she also pointed that out, that law, unfortunately, does not, it takes a while for the law to sort of meet up with what's going on and the involvement of family and the progression of the LGBTQ community, and the law is so far behind that it's...
Correct.
Yeah.
And we're under assault.
Yes.
We're under assault right now by the Republican Party in states all across this country, trying to take back the rights that we have fought for decades to get. And recently, Donald Trump made comments that white people are no longer given preferential treatment for their health care. It's people of color and people based on their sexual identity. Trying
really?
to rally a base against the rights that we have.
Yeah, I did not hear. That's very, very discouraging.
Right.
So, in closing, what would you like to share, or any take-home message for those who are listening to our interview?
Well, I think the last couple of years has taught me that I had strengths that I didn't know. Okay. And that if I look over the course of my life, I can see that there have been moments of crisis throughout my life. That's part of being alive. So what I would want to impart to people is that you have the courage and you have the resources internally to get through this, to get through the challenges that you're going to face as a caregiver. They're there. And if you look upon those times when you've been able to make it through a crisis that was unimaginable to you, you'll get that strength. You'll see it there in your life. That's the most important thing I want to impart. The other thing is, one day when the patriarchy is dismantled, which is my deepest abiding hope, because I think the patriarchy is what's destroying the planet. It's the root of all oppression, in my opinion. Once it's dismantled, then we'll understand what life-giving is about. That men will participate in life-giving care. There are a lot of men who are providing care to their partners and spouses during life-threatening situations. But I hope that one day men will equally share in life-giving pursuits, which is, of course, raising children, being a true partner.
Yes.
And that we stop eating meat and chicken. We have to have respect for the animal kingdom. I told my kitties, I will not eat you. I will not do that. I have too much respect for that. So I'm vegetarian. Okay. And I think that's important for the planet to survive too. That we respect the non-human community, the animal community. They've been steadfast. These little animals have been steadfast partners. So I want to impart that there's a sense of hope, even when one is confronting mortality. There can be a sense of hope.
Yes, this empowering take-home messages, Stephen, just like how I remembered you 30 years ago. It is just so wonderful, and I can't thank you enough for this interview, for imparting your knowledge and your experience and your wisdom so that our listeners can really take home inspiration. So thank you very much, Stephen. This has been absolutely wonderful.
Oh, thank you, Harlan. And just as a closing comment about you, I identified very early in your career that you were special, and it's turned out to be true.
Thank you very much. I really appreciate that. That means a lot to me, so thank you.
Thank you.